Hi, my name is Jonah Bailey, and today for HAE 605, we will be discussing heat illnesses. So according to the CDC, heat illness is the leading cause of death among high school athletes. This is really important for us working in the South because we see temperatures far exceed 100 during the summer, along with the humidity and everything else involved. In my professional opinion, I think this is the most crucial aspect of being an athletic trainer. It's one thing that you can't mess up. If you got kids having symptoms, you got to take care of it right then and there. There can be no mistakes made. The course objectives of today's lessons will be describe the different types of heat illnesses, prevention strategies, and then emergency care for heat illnesses seen in athletics. So the first thing we're going to talk about today is going to be cramps or exercise-associated muscle cramps. These are painful involuntary contractions. They usually occur in the calves, the stomach, the hamstring, the quads, the glutes, but you can get full body cramps, and that's when you really got a problem. They can happen in both the heat or the cold, so it's not just associated with the heat, but we're going to talk about it today in that manner. The cause of them is not fully understood, but most scientists agree that dehydration, fatigue, and electrolyte imbalances are the associated cause. Signs and symptoms are going to be muscle stiffness, involuntary contractions, contractures, twitches. Sometimes you'll be able to see them and it'll just kind of be a light, kind of like that, and other times it'll constrict up completely. So what we're going to do typically, we're going to hydrate the athlete with both water and electrolyte supplement, which can be a Gatorade or Gatorlights, things like that. Or they also make some Medilite pills. We're going to cool it down with ice, and we're going to try to massage it out too. I usually do it with the ice bag to try to get the cramp to subside, and we'll try to stretch it out too to try to get that muscle to relax. The next thing we're going to talk about is heat syncope, or fainting, as it's commonly known, but it usually occurs in unfit or heat unacclimatized persons who either have sudden changes in posture or long periods of standing in the heat. This is usually attributed to the venous pooling of the blood. I'm sure you all have heard of that whenever you've had someone have a fainting incident or something. Or it could be dehydration or low blood pressure, So first you're going to want to move the athlete out of the heat. You want to elevate their legs above the heart, and then you want to rehydrate and cool with continuing to monitor vital signs. All right, so next we're starting to get into heat exhaustion. This is one of the most common heat-related conditions seen in the athletic population. In this case, the heart is unable to pump enough blood, so it results in cardiovascular insufficiency and energy depletion. This may or may not be associated with physical collapse. Obviously, if it's associated with physical collapse, 911, we're activating the EAP right then and there. Symptoms are going to include fatigue, nausea, weakness, vomiting, dizziness, pale. They're going to be heavy sweating, have a headache, hyperventilation. Treatment's going to include moving to a shaded area. We're going to rehydrate them, and we're going to immediately cool them. As athletic trainers, we should utilize a cold tub. So let's talk about the cold tub, because this is very important. So cold tubs come in different sizes. They got some that can fit multiple people. They got some that just fit one person. They're usually going to be 50, 100 gallons, something like that. But we got to make sure it's going to be 50 degrees to achieve the cooling level. I personally just use, it's like a little barbecue thermometer. So you want to fill it up with ice and then have it. This needs to be preventative, okay? Not preventative, prophylactically. Like, you need to have this thing ready and not, someone's going into heat exhaustion. Let's get a cold tub made. The cold tub already needs to be ready. That's very important. First of all, because it's going to help increase the chance that the athlete's going to have positive outcomes, and also because that water needs time to cool whenever you fill it up with water, it's not going to be quite at 50 degrees yet. You may have to add more ice. So just make sure that you do that beforehand. If cold tub is not available, you can put ice bags on major arteries. This is usually the case, like if there's cross-country runners, sometimes running, they'll have some problems. So you can bring them in to the training room or just wherever they're at and do that. Because usually we're gonna have the cold tub mostly just for football in my experience. And it's also important to get a rectal temp, okay? This is kind of controversial, obviously, because especially when you're dealing with adolescents. But and when you got suspected heat exhaustion, it's really important because if the temperature is above 104, then we're looking at the next thing we're going to be talking about. And let's get into that, okay? So the main thing with heat exhaustion, they are sub 104 core temperature. So next, let's talk about the big boy, exertional heat stroke, okay? This is a life-threatening condition, and it's the most severe heat illness you can get. This is characterized by, as we discussed, having a core temperature above 104. The signs and symptoms are going to be collapse. They could be aggressive. They could be confusion, seizures, altered consciousness. And as a medical emergency, the temperature has to be lowered promptly. And this should include the cold tub, as we discussed, moving to a shaded area. If you can have fans, obviously we want to take off any of their equipment that they have, their clothes, and they really shouldn't be transported until their core temperature is below the 105, because ambulance isn't going to have anything to cool them off like a cold tub. Or whatever you're using. They do make other things. And as athletic trainers, this is the most important thing we can do. We got to act swiftly because this is a life and death. And if the patient is not cooled down properly, it can result in death. So now let's talk about prevention. We kind of know what we're talking about, what we're dealing with. So now we want to talk about what we can use to help minimize these heat illnesses. So the biggest thing we can do is acclimatization, okay, or acclimatization. So this is it's a gradual 7 to 14 day progression in which the athletes, especially those wearing equipment, are going to be introduced into physical activity in the heat. For football, particularly because they got heavy equipment on, and it's during the summer months, this is going to be your majority of heat illnesses. I mean, you'll get them from, like I said, the cross country, soccer. I've seen them in baseball, everything. But for football, since that's going to be our main thing, since we're down here in the South, the days are going to be 1 to 2. They can only wear a helmet. They can have shorts on, shirt, but they can't have anything more than their helmet. On days 3 to 4, they can start adding in the shoulder pads. And then on day 5, they can have full pads on. After day 5, they have to have less than 5 hours of total practice time. There's other rules too that we kind of won't get into, but in each state's a little different. I'm actually talking about, it's kind of like a federal thing, but this is the case in Louisiana. So they have cases you don't want to have more than 2 practices a day, and that's kind of where the less than 5 hours of total practice time comes in. There's types like you can have spring game, but you can't have this kind of game. So there's different things, but let's get back to the acclimatization. So along with acclimatization, during practice, you need to make sure that they have adequate rest breaks. There needs to be cold water always available. It doesn't matter. And if, we're kind of moving past this with coaches, but there needs to always be cold water available and shade to prevent these illnesses. But this is the discussion today. So if you want to kind of learn more on this topic, you should really read into the journals listed on the National Athletic Trainers Association website, or any of your local state affiliate websites on the topic. Thank you.